Good evening, everyone. It's a privilege to be able to share some of our work with you. I'm a paediatric infectious diseases physician here and also a researcher at MCRI, and I'm particularly interested in how childhood infection and the antibiotics we use to treat it, and indeed overuse to treat it, lead to increasing the risk of these adult non-communicable diseases that Catherine talked about, particularly interested in obesity and cardiovascular disease. So let's start by looking at these children. These children look healthy, but amazingly and depressingly, this is probably the first generation where these children will not live as long as their parents. That is a very sobering statistic. And the reason for this is, as Catherine has mentioned, the burden of non-communicable diseases, or NCDs. Now, you'll be familiar with NCDs. These are familiar diseases to you. Cardiovascular disease, for example, our particular interest is the leading killer worldwide, responsible for many, many deaths in Australia and worldwide. In Australia, it kills maybe one individual every 12 minutes. These diseases are responsible for the vast majority of deaths worldwide, and they have a disproportionate burden on poor and disadvantaged populations. They threaten to completely overwhelm our health systems. But why would a paediatrician and why would a Paediatric Research Institute be interested in these chronic diseases of adults? Well, for an answer, we could do worse than look to this man, James Heckman, a Nobel laureate and prize winner in economics. Heckman came up with this, which is the Heckman curve, which he modeled that if you invest early in life, before birth or in infancy, the social and economic return is much greater than if you invest later in life. And the same is true about preventing non-communicable diseases. If we intervene early, before pregnancy, during pregnancy, and early childhood, we have a much greater chance of changing the risk and reversing the damage. If you wait till adulthood when the diseases occur, a lot of the changes and a lot of the damage is irreversible. So these non-communicable diseases, what do they have in common? So what I say about cardiovascular disease was true to all these non-communicable diseases. Well, they're complex diseases, as Catherine said. So unlike the diseases that John Christodoulou will tell you about in a minute, these diseases arise from a complex interaction of many genes, small effects from many genes, and the environment. Crucially for us, they develop right across the life course, from before pregnancy, through pregnancy, and right through childhood. And although they affect adults, that's a huge but overlooked opportunity to intervene and prevent or reduce the burden of these diseases. Now, as I mentioned, I have a particular interest in cardiovascular disease, by which I mean heart attack and stroke and heart failure predominantly. Cardiovascular disease is due to atherosclerosis, or hardening of the arteries. This occurs right the way across the life course. You can see the early stages of atherosclerosis in the baby by ultrasound while they're still in the womb. Despite this, childhood, again, is a greatly overlooked opportunity to get in and prevent cardiovascular disease. Things are changing, though. The American Heart Association has come out with the bold statement to say that cardiovascular disease is largely preventable. So in order to realize this dream, one thing is clear: one size does not fit all. We need to understand and bring some precision to our investigation and our prevention. We need to know who's at risk, who's at the greatest risk, what we can do about it, and when we should intervene. We're brilliantly placed to do that here in MCRI. We have these flagship cohorts that you've heard about, such as the Barwon Infant Study, the only study in the world where we've tracked cardiovascular risk from birth onwards, and many other fabulous cohorts where we follow cardiovascular risk through childhood. We have increasing access to population-level data, which together with these fabulous cohorts and with the omics technologies, particularly genomics, which has been the first cab and the most successful cab off the ranks, but increasingly other platforms, we can bring precision to the question as who's most at risk and what we can do about it, and then carry those findings forward into our fabulous prospective cohorts, particularly Gen V 2020. Our ultimate goal is to ensure that our pessimistic prediction that these children won't outlive their parents is proved wrong. And that's our goal. Thank you.